Bismillahirrahmanirrahim. Welcome everyone. This is Dr. Waqas Ahmed from Pathology Department. Today we will be studying a very important and common pathology related to the gastrointestinal tract, which is chronic gastritis. So let's start our lecture with the learning objectives. At the end of the practical, you will be able to tell what is the definition of gastritis, what are the causes or etiology of gastritis, clinical features, investigations required to diagnose chronic gastritis, and the most important, morphology, in which we will study the gross pathology and the microscopic features, and in the end a brief overview of the treatment. So without further delay, let's start our topic. What is gastritis? Gastritis, as the name suggests, is the inflammation of the gastric mucosa. It is further divided into acute gastritis and chronic gastritis, but our main concern here is with the chronic gastritis. So what is chronic gastritis? Chronic gastritis is defined as a chronic inflammation of the gastric mucosa, which is also characterized by the presence of chronic mucosal inflammatory changes leading eventually to mucosal atrophy and intestinal metaplasia, usually in the absence of erosions. So in chronic inflammation, you will see infiltration by the lymphocytes and plasma cells as seen in different other types of chronic inflammations. Looking at etiology, the most common cause of chronic gastritis is chronic infection by Helicobacter pylori. It can also be due to immunological or autoimmune gastritis. Other causes include toxics such as chronic alcoholism and cigarette smoking, post-surgical, especially following enterectomy with gastroenterostomy, motor and mechanical obstruction and gastric atony, radiation exposure in people having chemotherapy, and granulomatous conditions such as Crohn's disease or other inflammatory conditions, and miscellaneous includes amyloidosis, graft versus host disease, and uremia. So these are all the causes of chronic gastritis. So let's talk about Helicobacter pylori gastritis. Helicobacter is a spiral-shaped bacilli which mainly affects the enterum with normal or increased acid production. So the main effect by which H. pylori causes gastritis is the production of the urease and proteases, which causes inflammation and also weaken the mucosal defenses. What are the virulence factors of Helicobacter pylori? Number 1 is mortality, which occurs due to flagella, urease production, buffering the gastric acid, bacterial adhesions to bind surface epithelial cells, and toxin, for example CAG-A. So let's talk about the symptoms of gastritis. The common symptoms include nausea and vomiting, stomach burn due to increased acid production, upset stomach, especially epigastric discomfort and pain, and loss of appetite or anorexia, and blood vomiting, which is also known as hematosis. This occurs due to the active bleeding or black, and the last one is black stool, or which is also known as melena, which occurs in upper GI bleed. How will you diagnose a patient with chronic gastritis? The common test includes rapid urease test. As you know that Helicobacter pylori produces urease, so that can be used to diagnose, and it is a very rapid test. We can also use breath test, fecal test for Helicobacter pylori antigen, antibody against Helicobacter pylori. Intrinsic factor antibody can also be done because due to the deficiency of intrinsic factor, the chronic gastritis also leads to pernicious anemia or vitamin B12 deficiencies. We can also do antibodies against parietal cells, and the most important one and the gold standard for the diagnosis of chronic gastritis is endoscopic with gastric mucosal biopsy, in which you can see the histological slide with your own eyes showing signs of chronic inflammation. So let's talk about the morphology, which is the most important concern for you guys. Talking about the gross feature, the chronic gastritis affects both the enteral and the body of the stomach, so both of the mucosa are involved. You will see reddened mucosa with coarse structures, as you can appreciate in these gross specimens. The mucosa is all reddened and the texture is coarse. The rugal folds are thickened, as you can appreciate in this picture. The rugal folds, these are the rugal folds which are thickened, and thin and flattened mucosa can be seen in these specimens. The microscopic features will show inflammatory infiltration of the lymphocytes and the plasma cells, which can be appreciated here in this histological slide. Neutrophils will be seen in granular and surface epithelial in the acute phase only. Some of the neutrophils can be seen here. Helicobacter pylori in the mucosal layer. Helicobacter will be present here. And intestinal metaplasia, which is also a precursor for adenocarcinoma, which means, as you can appreciate here, there are presence of goblet cells in this granular epithelium, which means the simple columnar epithelium has been converted into columnar epithelium with goblet cells, and It will also present with intestinal atrophy. So these are other three slides showing microscopic features of the chronic gastritis. In this A slide, you can see spiral-shaped Helicobacter pylori, which is stained with Watson starry silver stain. Organisms are abundant in the surface mucus. In the B slide, you can see intraepithelial and laminar propria neutrophils. And the C slide is showing chronic gastritis, in which you can see abundance of lymphoid aggregates with germinal centers, and abundant subepithelial plasma cells can also be appreciated in the superficial lamina propria, which are characteristic of Helicobacter pylori gastritis. So students, this is the histological diagram you have to draw in your practical notebooks. As you can see here the presence of Helicobacter pylori in the superficial mucosa, and also the intestinal metaplasia shown by presence of goblet cells and plasma cells. These are the plasma cells in the lamina propria and abundance of lymphocytes. Talking about the treatment, obviously to treat the chronic gastritis, the first of all you have to avoid the causes, which will be avoid heavy use of non-steroidal anti-inflammatory drugs, especially aspirin and ibuprofen, which are the most commonly used NSAIDs. Avoid alcohol consumption and cigarette smoking. Antacids will be used to reduce the stomach acidity. And the most important of the definite treatment is the combination of antibiotics and proton pump inhibitors. For example, clarithromycin, amoxicillin, flagyl, and omeprazole, which is also known as the triple regime for the treatment of chronic gastritis or peptic ulcer disease. Prophylactic and therapeutic vaccine is still at an early stage of development, and it might be developed in the future. So this is a picture showing summary of all the features related to gastritis. This concludes our practical on the chronic gastritis. You have to draw the histological slide on your this diagram on your practical notebooks for the attendance. Thank you and have a nice day.